I want to talk about no-shows and cancellations, kind of a problem everybody faces, gets frustrated with, and I want to give you some insight as to how to not have problems with no-shows and cancellations. You know, the psychology of the no-show cancellation is sort of interesting to me. It's a prioritization issue. You know, if you want to test this theory, ask your team sitting around you if they would ever no-show on their hair appointment or cancel on it last minute. And the answer you're going to get right now as you look around is they're all shaking their head going, no, and no way. And the reason why there's no way is because they can't get back in for like 3 weeks, and they are afraid they're going to look bad in 3 weeks without a haircut. Ladies, you'll look beautiful, I promise. But it's interesting to see how all this plays a role. So there's so much urgency because of vanity wanting to look good that someone will not cancel or no-show for a hair appointment, but yet for their dental appointment they will. Interesting how it works. Same with a nail appointment, because then it looks funny when your nails grow out. It's bad, it just doesn't look good. So what can we do to create greater urgency for our patients? And what we can't do is charge a $75 fee. I mean, we can, but I don't think that really does a whole lot of good myself. And the reason why I say that, there's this one day I'm in this practice a couple years back, and this lady gets all upset because she got this fee for her entire family no-showing this one day. And so she's all pissed, and the doctor's like, you know, we need to explain the value of my time to the patient. And I was like, Doc, if she cared about the value of your time, she would have no-showed on you already. Who cares? It does no good to give someone the speech about the value of time, because in their mind, their time is just as valuable as yours. I realize yours bills out at higher dollars per hour, but they don't care about that because it's not about them, right? That's the key. That's the key to making this successful if you want to eliminate no-shows and cancellations, is how can this be important to them? Because your team, as they looked around the room relative to the hair appointment, wouldn't no-show cancel because it's about them and their hair and their appearance. So for them, that's so important, they will absolutely make it. So how can we change that for your dental office? How can we change that for your appointment? You know, I'll give you a few examples, and I'm going to give you a whole array of them. So if you don't like one of them, like the first one maybe, don't tune out and ignore me for the rest of the time saying that won't work here, because there could be 6 others you might miss. I'll give you a few though. One, if you've ever done some bigger dentistry, say you're an office that does big cosmetic makeovers. Generally speaking, when you do a big cosmetic makeover, you usually get payment up front of some sort. Do you worry about those patients showing up? No. For 2 reasons. 1, they want to come in for their cosmetic makeover, and 2, they've paid you up front, they show up. So one option would be collecting deposits. I realize that's a little bit challenging, but I want to throw it out as an idea because I want to be comprehensive in my presentation to you. So if we collect some sort of a deposit, and I realize we can't just start right now and all of a sudden, hey, we're getting $400 deposits for every single thing, and not have our patients lose their mind. This is a process. Be very clear about that. But if we have deposits, there's no problem. Secondly, if we can create expectancy, you know, the patient who calls up, who's an emergency patient, who's dying to get in, generally doesn't no-show. I realize it does happen sometimes because there's a reason why they're in pain, because they're horribly irresponsible already. They haven't seen a dentist in 10 years, and that's why they're in pain. They have a problem. So there's already an issue with that person. But your normal patient who's in the office all the time, good patient, they have an emergency, you don't have to worry about it because they have the expectancy of getting out of pain. You know, if you go back to some of our case presentation material, we talk a lot about what motivates people to change, and it's to get away from pain or to gain pleasure. These 2 examples clearly illustrate that. If I'm a good, responsible patient who comes in all the time and I want to get out of pain, I will show up on time because I want out of pain. But if I'm a patient who's coming in for a cosmetic case and I'm really excited to look good and to get rid of snaggle teeth, all of a sudden I show up because I'm excited. I have expectancy. The challenge is when you have apathy. The person who's really not into it, Medicaid patient maybe is a good example, right? They don't have to pay the bill. They don't understand the value. They maybe don't have a high dental IQ. So they're like, yeah, you know, whatever. It's no big deal. I can just do it any time. There's an expectancy problem there, or in that case, an apathy problem. So what can you do in your office to switch that around? Well, let's talk a little bit about hygiene. You know, if we call it just a cleaning, which is what I hear sometimes in offices before they hire us, If it's just a cleaning, my expectancy is no big deal because it's just, right? Anytime we use the word just something, we've already devalued it because it's just something. You know, we did a whole show called I'm Just relative to the teammates in the office. And the minute I say I'm just an assistant or I'm just a hygienist or I'm just a dentist, I've devalued myself in my eyes and probably to the person who also is listening to me. So got to get rid of the word just as much as we can because it's not just a cleaning. It's so much more than that. Point is we can't devalue it with that. So we need to create more value. You know, the cleaning, the dental cleaning is a tooth by tooth inspection where we clean all the various areas of the teeth, the areas that you can't clean as a patient because you don't have access to them, because you don't have all these funny, cool instruments that we have, all these amazing tools that allow us to get places you can't get. That's what makes this a special cleaning. It's an amazing clean. It's like detailing your car. I mean, you clean your car all the time, and then you get it detailed, and all of a sudden it's kind of got new car smell. It looks clean, and you're like, holy cow, there's no more French fries underneath the seat. That is exciting. How can we create that same excitement for our hygiene appointments? Same for our restorative appointments. If we are just doing a filling, it's just a filling. It's no big deal. Well, hey, guess what? I'm not in a hurry. I don't want to pay the bill. I won't show up on time. I don't really care because it's just a filling. By contrast, if it's something that's to be excited about, hey, you know that tooth that you didn't like or the tooth that hurt or the tooth that did this, when we're done, that thing is going to be rock star awesome. Now we got to set a different expectation because if they've had a bite problem for a while, now we come in and we fix it, is that problem going to go away instantly? And the answer is no. So we got to be careful we don't sell too much expectation that's unrealistic, but we should sell an outcome that has this person motivated and excited for whatever the changes that we're offering. And if we do that, we'll have less problems with people no-showing for the restorative appointments.
What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.